Courtney Howard, speech number 3, informative speech, audience. Unlike the active mom, many women try to wait and have children until they are completely ready, both mentally and financially. Nowadays, with all the technologies and resources that we have, there are plenty of methods and concepts that you can use to keep yourself from conceiving a child. I'm going to tell you about a couple of different methods and how they work with your body so that you can be more educated in case you or your friends or family ever have to choose between what kind of birth control will fit their body the best. The first and most easiest way to protect yourself from an unwanted pregnancy is to wear a contraceptive. You can buy female or male contraceptives, and they do not require a prescription from a doctor. So you can purchase them from your local CVS, Walmart, Walgreens, and also at some gas stations. The type of birth controls I'm going to be explaining more thoroughly are ones that are usually prescribed from a family doctor or a gynecologist. The birth control pill is one option a woman can use when trying to prevent pregnancy. This is the most common method and is usually the cheapest type of contraceptive. There are a couple of different brands of pills, and depending on which brand you choose will also depend on how much they are. They usually run between $25 to about $50 per pack. It usually comes in a 30-day supply, and the woman will take one pill every day. How it works is it's also referred to as a combination pill because it has two different hormones in it. It has estrogen and progesterone. What that does when it's put into your body in more amounts than you already have is it actually prevents the woman from ovulating. So the eggs in the woman are not released, so if it were to meet with the sperm, then you wouldn't be able to have a baby. By choosing to take the pill, there are some disadvantages and some advantages. Some advantages for taking the pill is it can help you to clear up your skin if there's any acne problems or anything like that. Also, if a woman gets bad menstrual cramps, it can also help prevent that. When taking any sort of medication, there are also disadvantages. The pill has been known to make women gain weight. Another very common method used in birth control is referred to as the birth control patch, and it's also called Ortho Evra. It's a small patch that's usually beige in color, and the woman can stick it anywhere on her body. It does the same thing as the pills. It releases hormones into the body so that the mature eggs cannot be released. These patches usually run between $25 and $50, and for women that have trouble remembering to take their pills every day, this is a good method for them to use, because what you do is you stick it on your skin. The woman will wear it for 3 weeks, and then on the 4th day she will take it off, and then she will menstruate. The patch it works the same way as the pill does. It releases the same hormones. And one of the other disadvantages that it has is that wherever you stick it on the skin, it can irritate that spot, but you can take showers, do whatever you'd like while you're wearing it. Another method that is very similar to the patch is called the NuvaRing. What it does is it also releases the hormones, just like all the other contraceptives. It is a round, clear rubber ring that the woman inserts into her vagina. You leave it in for 3 weeks, and then she will remove it after a week so that she can menstruate. Once again, this is a very easy way to protect yourself from any pregnancies that are unwanted, and instead of taking the pill like the patch, you just put it in and leave it in there until it's time to remove it, and it is unnoticeable. The last type of birth control I'm going to tell you about is what's referred to as the shot. Technically it is called Depo-Provera. A woman has to have it prescribed once again by her doctor, and you have to go to a clinic or pharmacy or your doctor's office, wherever the shots are administered, to get it. It lasts for 3 months. The woman usually gets it in her arm, and like I said, it lasts for 3 months. So one of the disadvantages is that if If you do have any side effects, sometimes it can make you nauseous, or you can't gain weight. But unlike the pill with the shot, it's already all put into your body, so you'll have to wait it out for the 3 months until the shot starts to wear off. The shot is usually a little bit more expensive than all of the other methods. It runs between $35 to $75 depending on where the woman wants to go and get it done. But it is a 3-month thing, so unlike the pills or the NuvaRing, instead of having to do something every month, you just do it every 3 months. So it's pretty convenient. And those are a couple of the contraceptives that you can use. For those women that are waiting to have children or who are not ready, either mentally or physically, this speech is to inform you so that you can have information for yourself or for your friends and family in case they ever want to use one of these methods. So it's important to know how they work and how exactly what they do in your body. That way you can pick the best method for you or your friends to use. Thank you.